and thanks to all of our partners who are represented here. Believe it or not, there are some people who are not here. But this is it's a major project that we have coordinated, I'm happy to say, through the Attorney General's office, and I'll be telling you a little bit about the different parts that people play in this. We are experiencing a public health crisis in Colorado. People are dying every day from opioid overdoses. It's estimated that someone dies from a drug overdose every 9 hours and 24 minutes. Every 9 hours and 24 minutes, someone dies. That means in Colorado, 75 people a month and as many as 900 a year are likely to die from a drug overdose here in our state. Data from the state of Colorado was compiled by the Colorado Health Institute, and it was released in a report to the federal government earlier this year. The data will be appearing by magic on the screen on a map that is behind me, and they illustrate, I think, better than anything else can, other than personal stories, the explosion of drug overdose deaths from 2002 to 2014. Over those 13 years, drug overdose deaths increased in all counties across the state of Colorado, driving a 68% increase in fatal overdoses. There are counties in our state where death rates rank among the highest in the United States. As Attorney General, I chair the legislatively created Colorado Substance Abuse Trend and Response Task Force. We monitor drug abuse trends and partner with others to develop strategies aimed at averting and mitigating the impact of substance abuse in the state. The data displayed was shared and discussed at one of our task force meetings earlier this year, and I was moved to find a way as Attorney General to help change the statistics, because each number represents someone who was loved and valued. Each death impacts others, and that includes the dedicated law enforcement officials and the first offenders who come upon the scene of an overdose or a drug overdose death. There's a life-saving drug called Naloxone, which reverses the effects of an opioid overdose, and it revives individuals, preventing their death. Naloxone is now available in a nasal form known as Narcan, and there's a growing need for Narcan in our state. Today I'm announcing the Colorado Naloxone for Life initiative, which is a collaborative effort to provide law enforcement and other first responders training and access to Narcan. There are a number of partners in the initiative, and we couldn't have done this without them. The Attorney General does not often buy drugs, and she needs help to do that legally. And these folks made sure that we did everything appropriately and that the training that law enforcement receives will make them comfortable with administering Narcan when the need arises. I have made it a priority to allocate $264,500 from the Office of the Attorney General for this Colorado Naloxone for Life initiative. The funds come from a pharmaceutical lawsuit settlement and are intended for use in addressing the public safety. And I want to elaborate for just a moment on how we're allocating that money, because I think it's important that the public knows this. $187,500 of this money is going to purchase 2,500 dual-dose Narcan Rescue Kits and training and access to Narcan. And this is an example of what this dual dose looks like. The Narcan Rescue Kits are going to be disseminated to law enforcement personnel and first responders in 17 counties with very high rates of drug overdose deaths. Kits not needed in those counties, if there are any left, will go to interested jurisdictions until the supply is gone. Then another $44,000 is allocated for training sessions on how to administer Narcan. 10 trainings will be offered in 6 regions across the state between the end of September and the end of November. The trainings are free and open to the public. Law enforcement personnel and first responders from the prioritized counties will receive the Narcan kits when they complete the training. So the two go together. There will also be a train-the-trainer option for those who wish to teach others in their communities about how to administer Narcan. And those conducting the trainings will be Lisa Rayville, who you met. She is Executive Director of the Harm Reduction Action Center. Dr. Joshua Blum, an adult primary care physician at Denver Health, and Rick Brandt, Chief of the Evans Police Department and former President of the Colorado Association of Chiefs of Police. Then the remaining $33,000 of funding is going to be used for an upgrade of the Opioid Rescue app for mobile devices. Opioid Rescue not only provides instruction on how to administer Narcan, but it also will be used to collect information on overdose reversals. Research staff, the Colorado Department of Public Health and Environment, will analyze that data to determine the initiative's effectiveness. While increasing access to Narcan is one strategy for helping turn the tide of the opioid epidemic, I want to reiterate the critical need for residents of Colorado to support community-based substance abuse prevention efforts. There are many substance abuse prevention coalitions around the state that make a difference in their local communities and in regions. The dedicated folks who run those programs are very creative in stretching their resources, but frankly, they need more help in the face of this growing problem. And in addition, there is a need to expand access to medication-assisted treatment to help those who are ready to deal with their addiction. We must have more physicians and providers who are open to this evidence-based approach for bringing addicts into recovery. And it's something we all continue to work on in our jobs and our roles. I want to conclude my remarks by saying thank you to those law enforcement agencies that are supportive of their officers carrying and using Narcan. There's no greater reward in law enforcement than saving lives in the service of public safety. And thank you to other first responders who carry and use Narcan already, and those who are willing to do so. Thank you too to the members of the Naloxone work group and to the co-chairs of that group, Lisa Rayville and Dr. Joshua Blum, and to Rob Ballack, our host today, of the Colorado Consortium for the Prevention of Prescription Drug Abuse. His work is extremely important to all of us and to our task force. And these folks have laid the groundwork to expand the acceptance and access of the use of Narcan in Colorado. My sincere gratitude and appreciation is also extended to Dr. Bill Berman, the CEO of Denver Health and Hospital Authority, and his staff who have assisted us in acquiring the Narcan kits. And thank you to each of you who are standing here with me today. Again, I very much appreciate your time and your effort and the fact that you drove from Otero County as far away as the southeast part of our state where we have such a serious problem with opioid overdose deaths. Thank you so much for being here with us today.